Everyone, and welcome to today's COVID-19 office hours. I want to welcome you to the office hours and spend just a couple of moments going over some tech notes and logistics before we turn things over to the team at HUD and our presenters for the day. So just as a reminder, we are recording the office hours and we will post a copy of that recording along with the slide deck and the content from the chat to the HUD Exchange. Just please give the team a couple of business days to post that content, and then you'll be able to find them on the link that's up there on your screen now. Additionally, if you have any audio issues during the webinars, we encourage you to go ahead and switch over to the phone audio. That is an option for everyone. You can do that by dialing into the numbers that are both up there on the screen now and that are in the chat, and you can do so at any time during the webinar. Additionally, everyone will remain muted throughout the duration of our time together today, but we absolutely anticipate and hope to hear from you throughout through the chat feature. If you're not familiar with where to find the chat feature, just look on the bottom right-hand side of your screen, and you should see what looks just like a little message or a chat bubble. When you click on that, it'll open up that functionality for you. Please send all questions, comments, thoughts in through that chat feature. And when you send them in, just please take a moment to make sure that they're going to everyone. It should default to that, but if it doesn't, you can always select the arrow that's over on the right-hand side of that menu and select everyone. And with that, I'm going to turn things over to Norm Suchar from HUD's Office of Special Needs Assistance Programs. Norm.
Thank you so much, Natalie, and welcome everyone to the office hours session today. We have some great presentations, so we're very excited about this. So we are going to, we have three presentations today. We're going to start with our regular Centers for Disease Control and Prevention update. Ashley Meehan will be providing that for us today, and they have some information about some new CDC resources as well. We will get an update or some information from the Internal Revenue Service, Christine Foote, who was last with us a few months ago talking about the child tax credit. We'll, talk more about some of the resources that we should be taking advantage of that are available through the IRS. And then we have a great presentation from the Tarrant County Homeless Coalition in Fort Worth, Texas. Alex Dunn, Anthony Hogg, and Wayne Pollard will be providing that. They'll be talking about their EHV work and the partnership between the continuum of care and the housing authorities. Very cool outcomes, great work they've been doing. So we will hear from them as well. So you also have many people from the Alliance who are standing by, ready to answer your questions. You can type those questions anytime in the chat window. You are welcome to ask questions about any of the content we present today, or if you have questions about other items, we will do our best to answer as many of those as we can. Also, if you have any examples or any sort of successes or challenges you'd like to share in the chat window, please feel free to do that as well. Everybody loves hearing from their partners and colleagues in other communities. So with that, I'm going to turn things over to Ashley from the CDC to give us our COVID update. Ashley?
Thanks, Norm. Hi, everyone. My name is Ashley Meehan, and I am a health scientist at the Centers for Disease Control and Prevention, and I support our homelessness unit within the COVID-19 response. Next slide, please. So here's what we're looking at in terms of the trend in cases over time. So we show this every week or every office hours, and we can see that cases have really quickly come back down, which is a great sign. The 7-day case rate per 100,000 people, the last time we were on office hours was over 700, and now it's down to around 250. So that's a great sign. We are moving in the right direction. I do want to take this time to emphasize that continuing to utilize those prevention measures that we have in place will keep us in a better spot than we were a month ago. So just want to emphasize that, and we can go to the next slide. And we've also been keeping our eye on deaths over time. So the most recent surge, the Omicron surge, did not have as drastic of an increase in deaths as our last winter surge. So that's a great sign as well. So we're looking at around 927,000 total deaths. Next slide, please. All right, so the long overdue guidance updates. We did update our guidance to reflect the updated quarantine and isolation duration. We've talked about this on office hours, and if you joined our webinar back in January, we talked about it there as well. It is finally up on the web for you all to go look at. So in the slides, that link is included. It explains what our recommendations are, what kinds of things you can consider if you're in crisis mode and things can't be maintained, what other considerations you should be making as you're thinking about quarantine and isolation during a crisis mode scenario. So we can go to the next slide. So just as a refresher, our recommendation is that clients and staff should quarantine and isolate away from congregate shelter for 10 days. There's more nuance about this in that guidance page, but essentially, you know, the risk for spread of COVID-19 is within the congregate setting. So if you're a staff member of a shelter, for example, and you test positive for COVID-19, you need to isolate away from the shelter for 10 days. However, you can go into the community after day 5 in alignment with the general population guidance to do things like grocery shopping or, you know, childcare, whatever else you need. So as long as you're away from that congregate setting, you can follow the general population guidelines. Similarly, if you are operating a shelter and they have, you know, off-site non-congregate isolation, and clients are isolating there for 10 days, they can leave and go to work after day 5, as long as they come back to that non-congregate isolation facility. They can return to a congregate shelter or congregate facility with other people after 10 days. So hopefully that gives you and your communities a little bit of flexibility, you know, to let people go back to work and, you know, let clients continue their livelihood. So that's the update there. We do have a clause in our guidance that specifies that during crisis scenarios, decisions to shorten quarantine or isolation should be made in coordination with your state or local public health. So for this, if you are experiencing really extreme staffing shortages or you have exhausted all possible isolation spaces and you still are having to turn folks away or you can't manage or a shelter cannot maintain operations, then you could discuss shortening those durations with your local public health department to figure out what risks need to be balanced in that decision making. So we do offer that flexibility for communities that are finding themselves stretched far too thin. Next slide, please. And I just quickly want to cover what we know to be effective isolation options for people experiencing homelessness. So ideally, the most effective isolation would be off-site away from a congregate setting. That would include individual rooms with individual bathrooms, and that could be like using hotels or motels. That's an example there. Another off-site option could be cohorted or semi-cohorted rooms with all people who have tested positive. Again, that's still off-site. So off-site away from a congregate setting is most effective. If you do need to isolate on-site at your congregate setting, if you have a section of that facility or of that shelter that has individual rooms with individual bathrooms, prioritizing those for isolation would be best. If that's not available, then you can consider cohorting on-site at the congregate location using partitions and having things clearly marked. But again, these things should be discussed in consultation with local public health. They'll help you think through the facility layout, ventilation, which was on the office hours a couple weeks ago. They'll help think through,
Sorry about that.
They'll help think through, you know, your client characteristics and, you know, who's at high risk and just general things that you'll need to consider when deciding how to change quarantine or isolation. So again, not ideal if you're isolating on site, but we realize that that may have to be the reality for many people. So working with public health to figure out the best way to do that as safely as possible is ideal. Next slide, please. So that's it for me. I'm happy to take questions. I know This probably would have been most helpful a month ago, but let me know if there are any questions, any comments, if you're coming up with any challenges with this. We're happy to think through anything, and I'm also happy to answer questions in the chat. Back to you, Norm.
Great, thank you so much, Ashley. And then that guidance is such a big benefit to us, so thank you so much. I know you guys worked really hard to get it out and get it like spot on. So thank you so much. Again, if you have any questions for Ashley, please feel free to type them in the chat window. We're going to move to our next presentation. I'm very happy to introduce Christine Footed from the Internal Revenue Service. As you can see on the slide, Christine's going to talk about what's new with refundable credits and other benefits. So Christine, I'm going to turn things over to you.
Hi, everyone. And so normally you think Christmas is the best time of the year, but we at the IRS believe that filing season is the best time of the year. So what I'm going to talk to you about today is just some of the refundable credits that you may have heard about or not heard about, but I want to give you a refresher. I'll also provide you with some resources, and then when I'm done, I'll put some of the links into the chat. So next slide, please. First is the child tax credit, which I'm sure a lot of you have heard about. There are 3 refundable credits this year related to child tax credit. So we have the child tax credit, the earned income tax credit, and then the child and dependent care credit. And these credits are going to be refundable even if you're not required to file a tax return. So even if you didn't have the income for it, we're urging you to file a tax return like we did previously for the economic impact payment, which everyone refers to as the stimulus checks. So we're going to talk a little bit about that today. Again, we'll also talk about the 3rd economic impact payment that some of you or your community didn't receive in 2021 and still can receive that payment if they file a tax return. So next slide, please. So here's a few changes that happen, and all of these are just for tax year 2021. So keep that in mind. It's not, nothing has been changed for 2022. So it raised the minimum qualifying age. So if you had child tax credit in the past, they could not have turned 17 by December 31st. Well, for this tax credit, they can't turn 18 by December 31st. So it added an extra year. It increased the maximum credit amount. So before it was $2,000. Now it's $3,000 up to $3,000 for children 5 to under 18 and $3,600 for children under 5. Now, or under 6, I should say. So I don't know about you, but I think it costs more to raise a teenager than it does a 4-year-old, but I didn't get to make that decision. So those are the amounts. They also will phase out the amounts based on income. So I'm sure you may have heard it in the news. You are eligible for up to 50% of that payment in advance. So the payments had started last July, and the 15th of every month or around there, depending on if it was a weekend, a portion of that payment you received. Now that was you up to 50%. The balance of that is what you will get on when you file your tax return. So next slide, please. So as I said, $4,600 for each child age 5 and under, $3,000 for each child age 6 through 17 at the end of 2021. There is no income that's required to claim this credit, so we're going to urge everyone to file a tax return. Now, the qualifying child must have a Social Security number and be claimed as a dependent on the tax return. Now, there are qualifying children that are foster children or extended family, and that's where I will provide a link in the chat after, where you would go to www.irs.gov/child tax credit 2021, and that will answer a lot more of your questions. Next slide, please. So the child tax payments that everyone received in 2021 were based on whichever tax return we had on file. So it was either 2020 or 2019. So what you have to understand about that is when the payments started in July of 2021, you may not have filed your 2020 tax return yet if you had an extension. So that's when we used the 2019. We made monthly payments that ended in December. Congress has not extended the advanced child tax credit payments for 2022 yet. We don't have any indication, yes or no, at this point. We're just, all of our legislation is just based on 2021. Next slide, please. So how do we reconcile? Because you've received these payments and you don't get the payments from July through December plus another $3,000 or $3,600. Unfortunately, it doesn't work that way. So when you file your tax return, any software program, a tax pro is going to ask you, did you receive letter 6419? So we sent out letters to everyone who received child tax credit payments with the amount that they received in 2021. On the software programs, if you use TurboTax or any of them, they're going to ask you, did you receive letter 6419 and what was the amount on there? So make sure you keep that letter with your tax documents, because if you don't prepare your return on your own and somebody else prepares it, or you go to a Vita site, they're going to ask for that information. Next slide, please. So as I mentioned earlier, the third economic impact payment. If you did not, that's another question that's going to be asked when you file your tax return. Did you receive your third economic impact payment? So those were paid, I think they started in like February of 2021 and were sent out for a couple of months after that. You will also be getting a letter from the IRS, it's letter 6475, that says how much you received. And again, keep that letter with your tax documents, because if you didn't receive it, you may be eligible for it when you file your return. Next slide, please. So another credit is the earned income tax credit. And there was quite a few changes to this. It actually expanded for taxpayers with no qualifying children. So that could be young adults, not students. They can't be a student in college. Believe me, I tested it out because I had to do my tax return for my son, and I was like all excited because he was going to get some earned income tax credit. And then it said no. And I was like, what do you mean no? And then of course I looked up the rules, and a student doesn't qualify. But where it does come into play is people over 64. So seniors can qualify with no qualifying children. So this is a huge tax incentive for this year as well. Again, it's for 2021. It also increased the investment income amount. There's specific rules for separated spouses. I will also provide the link for you in the chat after I'm done. It's an easy link, www.irs.gov/EITC. Next slide, please. So the child independent care credit, those amounts increased as well. So anyone who was paying for child independent care credit, there's going to be incentives in that. This also increased by quite a bit. So, you know, one more advantage to actually incentivize your community to file a tax return. When you add up all of these different credits, it can be a car for somebody. It can be, you know, a down payment on a house. It can be paying off debts. It can be thousands of dollars. So we just want to make sure if they're entitled to it, they need to take it. Next slide, please. So charitable contributions, this is for all individuals. And this you don't have to itemize your deductions. So it's a one-time deduction, $300 for individuals, including married filing separate, or $600 for joint filers. And that, again, the question will be asked on your on your software, or your tax professional will ask you for that. You'll have to have documentation that you either paid by check, credit card, whatever you use to make a charitable contribution. Next slide, please. So what's important? Everyone should be gathering their records. So you should have received by now or within the next short time all of your W-2s and 1099s. Your health insurance marketplace, the 2 letters I mentioned, the 6419 and the 6475. All of that needs to match. When it doesn't match, there's where your delay is in your tax return and getting a refund. So you want to make sure everything matches. And I will give you an example because I seem to always have the examples of everything that probably could go wrong with something. So again, I'm going to file my son's tax return. I'm going to do it electronically because he wants his money fast, right? And that's what we tell everyone. And I put everything in, press the submit button, and then you wait. So you'll get either a text message or an email that says that the IRS has accepted your return. Rejected. I'm like, oh my gosh, I work for the IRS and a return is getting rejected. So I go back, I had put the wrong adjusted gross income from his 2020 tax return in there. And so that's where I'm telling you, make sure you have all your documents, make sure your numbers are correct. Of course, I was checking everything else like social security number and, you always want to make sure everything's correct. And we had moved to a different state. So I'm like, well, maybe that was it. No, I just put the wrong number. I transposed 2 numbers, so it got rejected. So again, don't make my mistakes. Next slide, please. So tips. We have Free File. Again, another resource, irs.gov/free file. There are income limits. It's 73,000. And there's also some of the companies that we have an alliance with will allow you to do state returns for free. We also have Vita sites, which are free tax return preparation sites. You can use your own commercial software. There's a ton of it out there. You can find a tax pro. We recommend direct deposit. It makes your refund faster and safer. We also have a tool on irs.gov, or there's a mobile app, Where's My Refund? Again, I filed my son's return last weekend, checked it yesterday. It already told me that his refund will be deposited by next week. So it's a great way to see when you'll be getting a refund, especially if you're anticipating a bill coming up. Next slide, please. So how long will it take? Well, we normally will say it's up within 21 days. My son's, for example, it'll be about 10 days, but that's as long as we don't detect any errors or there's no missing information. So if there's children and you're claiming child tax credit, you got to make sure their social security number is there. Anytime you use any of the software, it's usually going to guide you through. And if you've used the same one the prior year, it transfers all the information over to the current year, which makes it really nice. Next slide, please. So here's the resources I was telling you about. The Schedule 8812 talks about qualifying children, instructions. Pub 5533 is why you should create an IRS online account. You can always check information from prior years. We have help tools. We have so much information to try and guide you. I think we're always trying to make our website a little more user-friendly. It's in several different languages as well. So if you have any questions, I feel free to take them. If I can't answer it for any reason, you can send me an email and I will find the answer for you. And
Great. Thank you so much, Christine. So we do have a couple questions, if you don't mind. We have a few from the chat and I've written down a couple here. So one person asked about form letter 6419. If that letter is lost, is there a way to get another one?
So here's what you can do. There's 2 things. You can set up an IRS online account and that will show you all the payments that you received for the child tax credit. What I did was, if you had it deposited into a bank account, you can go back to your bank account statements and look at each one. But we're not going to reissue another letter. I would say, if you don't have an online account, then get an online account and you can look at all of your tax records.
That makes sense. But for a lot of our organizations, they're working with people experiencing homelessness. Obviously, in some cases, they will hopefully be helping them get free bank accounts and things like that. But sometimes it's a little more challenging to make that work. And so I wonder if you could sort of, looking at it through that lens, like what kind of preparation process do you mentioned some of the different softwares available and things like that. Given that we have that we're working with a lot of people who don't have bank accounts, who probably aren't going to get, professional tax preparers or things like that, what can a shelter or a permanent supportive housing program or an organization that is working with people who have experienced homelessness, what can they provide to their clients that is going to help them through this process? What would you recommend for them?
So we have Vita sites, and the Vita sites are volunteers who have gone through a process and they're all normally simple returns, which is what you're going to need, is a simple return done. It's not going to be businesses or anything with, any extensive schedules. They can go there and get their return prepared. They're still going to have to bring their documents with them. And so that may be a challenge. The other thing that I can think of is if it's a larger organization, we have an organization called SPEC who works to authorize basically Vita sites, and maybe they can set up a Vita site at their location if there's enough participants that you think would take advantage of it.
Is there someplace people can find out more about the Vita sites?
IRS.gov/Vita.
Fantastic. Thank you so much. So we have another person who asked about, they said that they have a client who was told that they couldn't get their refund until April. Is there a way for people to easily check on the status of their refunds?
Yes. So if you go to irs.gov, on that front page, there is a link that says, "Where's my refund?" And the only information you have to provide is your social security number, your the refund amount, and there's one other item, and now I can't remember oh, your filing status. Sorry. So those three items will, when you put it in, there's 3 blocks. It will say return accepted. It'll say refund expected, and then it'll say refund paid. And it will actually tell you when the amount is going to be, say, for instance, deposited into your account. So it's an easy way, three pieces of information, and you'll find out where your refund status is.
Great. And Letitia very helpfully put that link to the Vita site locator in the chat window. So if you're interested, please go ahead and click on that and you can find local sites. So you mentioned that for larger organizations, there's a way to, for people to become a Vita site. Are there other kinds of partnerships between organizations and existing Vita sites that people can explore?
So AARP has their tax aid. I believe 211 is doing, I know they were helping some with getting their economic impact payments. I know they help with filing tax returns or directing them. I know, and United Way, those are the big ones that are helping.
Great. Well, thank you so much, Christine. It's been a pleasure as always. Incredibly helpful information, both for the people on the call today and the many, many people we serve. So if you have more questions for Christine, feel free to go ahead and type them in the chat window. In the meantime, we're going to move to our next presentation. I'm very, very pleased to introduce our friends from Fort Worth and Tarrant County, Texas. Anthony Hogg, Alex Dunn, and Wayne Pollard from the Tarrant County Homeless Coalition and Tarrant County Housing. And Alex is going to kick us off. So Alex, I'll turn things over to you.
Hey, thank you so much, Norma. I appreciate it. So what we're going to be talking about today is emergency housing vouchers and how our community was able to quickly use the emergency housing vouchers with a quick relationship that was built between us and Tarrant County Housing. I think that Tarrant County echoes a lot of what was said in the beginning of the EHVs about how excited we were about this opportunity, how grateful we are to HUD and to your office, Norm, that we know we saw Snap's fingerprints all over it. So very excited about that. Next slide. Okay, so Tarrant County is in North Texas and includes the cities of Fort Worth and Arlington, which is about 2 million residents. So we're a pretty large community. We are also one of the fastest growing communities in the country. I heard, if you believe, what's the economics part? Anyway, Freakonomics, the Freakonomics podcast, that the Dallas-Fort Worth Metroplex, which Tarrant County is half of, will be the third largest metro area in the country by 2030. So we're pretty large now. We're growing very quickly. Within our community, we have 3 public housing authorities and 1 continuum of care. Wayne Pollard, who's going to be presenting with us today, is the leader of the Tarrant County Housing Authority. Just to give you an idea of what kind of size we are as a COC, our annual renewal demand in the last competition was about 15 million. Next slide, please. Okay, so we are really excited about how we were able to implement emergency housing vouchers in our community. So Tarrant County Housing Authority, they were awarded 85 vouchers and used all 85. Arlington Housing Authority was awarded 89 vouchers and so far has utilized 65 with 48 issuances. These are all terms from the EHV dashboard that HUD has. Fort Worth Housing Solutions was awarded 133 vouchers. It has used 69 and has had 70 issuances. We were able to fill all of the referrals for our vouchers in about 6 weeks through a huge community-wide push that we implemented. And that had a really big impact on the ability of the housing authorities to actually put people into housing, which was our goal, of course. The other thing of note is that when you look at these numbers among the public housing authorities in Texas, they're the top public housing authorities in Texas as far as utilization. And then when you also look at housing authorities that got more than 50 vouchers, these are in the top of the pack in the country, and Tarrant County is actually #1 or #2 in the country as far as that. So we're really grateful to have good partners. Next slide, please. Okay, so some keys to the success that we had where we did a proactive outreach to the PHAs as soon as we knew that EHVs might happen at all. We reached out to all 3 of our public housing authorities actively and said, hey, we know this thing might be coming. We want you to know that we're preparing right now to help you take these. We can fill this through coordinated entry. We're excited to work with you. Really just to make sure that they knew that we could handle it and that we were willing to take it on. We also developed a call that was weekly with all of the housing authorities in one call every week in the beginning of our process. And I think that really helped us to coordinate efforts, to learn from each other. The housing authorities were able to learn from each other as well. And it really helped us coordinate this thing because, as everybody knows, this was something that had never been done before. There wasn't really, while HUD did put out technical assistance, there wasn't like anybody who had done it before that you could really lean on as good practices. So having everybody on one call with one goal to fill all of these vouchers within 6 weeks was very important. Out of that one call with all of our providers, our housing authorities all agreed to use one application for the emergency housing vouchers, which was a really huge thing for our community because it meant that case managers and shelter staff didn't have to think about which application they should fill out for which person. It was all the same application. And then on the back end, we assigned them to a PHA. All of our PHAs did have COC programs when we started, so that helped. We had somewhat of a relationship with them. I think it's fair to say that our relationships between the PHAs were varied in their strength, but they at least knew our names, so that helped. And as a COC, we really wanted to keep the bonus money that the housing authorities could get if they were, depending on how many leases they had by a certain date. We wanted to keep that in mind, and we wanted to make sure that our housing authorities were able to get as much of that bonus money from HUD as possible. It was going to help them to provide better services for people, and it was also, you know, the kind thing to do. We wanted them to work with us. We wanted to say that we want to work to help you get as much bonus money as possible. Next slide. Some other keys to success was that we got buy-in from our service providers. We knew that this wasn't something that we could do just as a COC, that we needed service providers to identify people who would be a good fit for this. We needed to help them have people fill out applications. We needed to have them help make sure that clients got to voucher briefings, or that clients knew about voucher briefings, and just case manage through the process like we do anytime we move into somebody into housing. And we knew it was going to take a lot of work. So it was really important to get the buy-in from our service providers, and to continue to do that. We had a past experience where we were able to quickly fill a project that was built with CARES money, a PSH project that was built with CARES money, and we had to fill that project within 6 weeks. So the project was built like the end of November. It had to be completely full of everybody by the end of December because of the CARES regulations. And so our community had practice in a small project of about 120 units to like find people, move them in quickly. So we had a learning experience from that we leveraged into this process. And we're going to talk about what that process is here in a minute. This was one that was hard, I think, for us to decide to do, but it ultimately made sense and I think was really important. We canceled unnecessary meetings and activities for the COC. We knew that our service providers were going to have to do a lot to make this lift happen. And we said, this is the most important thing that we can do in our community in this 2 or 3 month time frame. So for instance, we have subpopulation committees. We canceled subpopulation committees for that 2 month period. We had, I'm trying to think of what else we canceled. We had meetings that were kind of recurring that we just decided we don't need people sitting in meetings. We need people out there talking to clients, getting them in housing. And then the last thing was we developed a friendly competition for our COC partners and the PHAs. There was not public like out in the community, but there was public between our partners and between the public housing authorities, monthly data about this is how many people Tarrant County housed, this is how many people Fort Worth housed, this is how many people Arlington housed, and the housing authorities had a friendly competition going there. And then among our COC partners, we said, you know, X shelter got this many people into EHVs, Y program got this many people into EHVs, and so everybody competed because they wanted to be the best. So that was kind of fun. Next slide, please. Anthony?
Yep. Okay, so the assumptions that we made. One of the big assumptions we already made was many people in our COC needed long-term rental assistance, but they didn't need the supportive services. We looked at it. We do have a pretty large, I guess large, because I'm not sure comparatively, but of older adults that are literally homeless in our system. I would say about 38% of them are 50 or older. So our assumption is that they can probably no longer work, but they might not need the supportive services. So because with that, and the same thing when we did the move on strategy, we assumed that the people who were moving on from PSH also didn't need supportive services. So our idea was not to try to create supportive services for the people who get housed. We added 20% to our referrals. So, and give an example, what that means is that if we had 100 EHVs, we gave 120 referrals to the housing authorities. And what Alex mentioned earlier, we had that the project of Casa de Esperanza, essentially we were housing, and we did the same logic. We went 20% over because we knew that there's some people that are just going to drop off. And so as long as we keep overage, it gives the housing authorities to use up all their vouchers. Because of the previous project, emailing back and forth was not an option. Emails are a horrible way to send client information. Everything gets lost and no one can see what's going on. So that did not happen. And the previous experience primed us for that. And we needed to work closely with PHAs and have one place where all the client's information can be tracked. Everyone knows what's going on and everyone can find everything essentially. We'll go over that part in a couple of slides from now. Next slide. This is probably the most important assumptions that we made. If we are not successful, we will not get this opportunity again. They're never going to these referrals are never going to fall in our lap, and we better, jump on them as we can. And if we use all of our EHVs, maybe we can get lucky and get some more EHVs. That's how we were looking at it. All right, next slide. Population we wanted to serve, we initially broke it down to 50% move on. Move on meaning move on from PSH. 50% literally homeless, which would include DV. DV was also included in that number. The move on wasn't perfect for multiple reasons, but it still was probably around 35 to 40% of the population. And we did end up put at risk, which is our essentially move on from wrap housing, help fill that gap, because we have a lot of people in wrap housing for CARES dollars who are likely not going to make it either because they're older adults. That's why we moved them into housing to get them out of the shelters. And of course, all the people that can do this without, not needing services, literally homeless, if they can get through this process with the PHAs, our assumption is if they can find their own housing and move on, they probably wouldn't need services. So everyone who made it through all the steps are kind of self-selecting. We didn't create a fancy assessment for everyone to do that would take everyone's time and slow down the process. We wanted to go as fast as possible. Next slide. Barriers to overcome, build relationships quickly. Like Alex said earlier, we have a really good relationship with all of our partner agencies. We have relationships with our public housing authorities, but those vary depending on the public housing authority. The one we have probably at the beginning of this, least amount of relationship or least amount of contact is with Tarrant County Housing Authority. That of course has changed since we've been through HEVs, but we knew of each other. We see each other in some meetings, but we didn't have that much interactions. Doing something like this has never been done before. It's of course challenging in itself. The next three we can combine together is transportation, critical documents, and landlords. This is essentially the iron triangle of barriers when it comes to housing. These are the three things that stops people from coming to housing, and we know it. We know that going in. The good thing is, and that's kind of why we went with a heavy move-on strategy too, because we expect the transportation and critical documents to, and even landlords, because if they don't have to move, to actually kind of self-resolve itself, because they should have all those. The negative for the move-on is for some of them, the subsidy was different. What our COC vouchers paid and what the HVs paid wasn't exactly the same. So that led to a challenge, and that's why some people did not move on. Didn't all of our service providers to move really quick. That is, and we've been running for a long time. Getting our service providers is another project we put them on. So that was a challenge. And we had to do our jobs too. This was on top of our normal jobs. We still have to do court and entry. At the time we started this, we had 330 matches going on through court and entry, not including the EHVs. So we had to, we had another 300 additional, essentially matches with EHVs on top of that. This drop in our lap. So we still have to work our regular jobs and be able to assign people to the EHVs. Next slide. The referral logic, kind of already went through that, but that's what I said earlier, is like who we decided to refer and the logic of how that would work. The universal EHV application online, that is built in our HMI system. So what we are allowed to do is once we agree to the universal application, the universal, such house and EHV application. Everyone had access to fill it out. It was all done online in our HMI system. The client can sign that document online, and it could be exported to a PDF and then uploaded to our data warehouse, where most of our essentially where most of the magic happened when it comes to the referral process. And we also had an online application on our website that actually synced up to our HMI system that was for that risk. Next slide. Internally, this is for the first one. Internally, we dedicated a lot of staff up front. We had 10 staff across 2 different departments, 3 directors, me, Alex, and our executive director, Lauren, 3 managers and 4 staff, just to focus on this, at least in the beginning. After the first 3-4 months, we wind this down and everyone went, to do their regular jobs for the most part, except for my corner entry team. But we did, and when staff, I had Alex is part of, she's director of planning. So all of her staff jumped in board with my operations staff to actually focus on this and try to get this done and roll it out as smooth as possible for our PHAs and for our service providers. We had a total of 11 COC agencies working to get these applications filled out, gathering the critical documents, and working in our Green River system to make sure everything was running as smooth as possible. Ongoing communication, especially in the beginning, because this is all new for them too, for our service providers. So we had weekly meetings, one for 2 different groups that also the PHAs attended. So PHA staff attended these meetings. On a Monday, we would meet with emergency shelter staff, actually 3, I guess, emergency shelter staff, and talk about the process. PHA would ask questions about clients that they were having issues with. On a Wednesday, we had it for our PSH, rapid housing, and we had street outreach. So they were also working with and the PHAs would attend those meetings too. Next slide. The cohort. Now this is from our data warehouse. This is where we shared most of the information. This is where in the practice run, we did this with one of our PHAs was over the Casa de Esperanza. This is where we got the idea of using the cohorts. And so here is where we collect information. The public housing authorities had access to the same warehouse as all the end users. And not only were we all tracking the same clients, they saw who got who we put on their move on list. We also all the critical documents are up here too. So the applications is here. Anything else that the public housing authorities needed to give the client a voucher is located here. So all they have to do, you'll see it right there in the name, right next to age, just a little letter right there. That's actually a client's name. If you click on that, that will go to client's dashboard where you can see all their files. And then that's how we kept up with the files. We didn't email. By having one central location, everyone knows where we need to go and what they need to work on and where a client's at in the process. So right here, you see the beginning of this. The days on the cohort is how many days, this is a little bit, so it started a long time ago, so you can see how long they've been on the cohort. You can click the next slide. And this is just multiple sections of the same cohort. So it's not like, it doesn't look like this. This is a long line. You're just seeing 3 parts of it. You'll see that at the top corner, left-hand corner, it says notes. There's notes in there where the PHAs will leave a note. The case manager will also leave a note. Sometimes we left a note saying what a client needs. If they're missing a document, that's all stored there. We had things where document ready. We had a service agency, so you know what's the provider's agency's name. It also had the provider's agency, the case manager's email and names right there, so they knew who to contact if we have any other questions. That's kind of key. Even though we put the notes here, we still don't know who. We don't always know who's the case manager that's actually working with the client, especially if they never put a note in. That's how we distinguish that. We had the date that we did the application. The voucher briefing schedule, because we want to make sure that it got scheduled. Did the client show up? That's what their little check mark is for the voucher briefing complete. We know that they actually got the voucher. That's what it's supposed to mean. The house inspection, lease date, and of course the HAP. And we monitor this. I look at this about now, even though we're pretty far in the process, I probably look at this 4 times a week, if not every single day, because I'm always looking at the HAP. Because our system doesn't exactly match the online system. There's sometimes a delay, so I'm always wondering where we're at in the HAP. Pretty much, I the key to what yeah, our success. I think next slide, is it Wayne? Oh no, sorry, not Wayne's turn yet. And we also we do the exact same, well, very similar process for our wait list. So we have a wait list. We're all, because we do have clients who drop off, who are not going to make it, who are declined for whatever reasons they're declining, or the time runs out for their time to find housing. So we have we maintain a core wait list, so we can always add new clients to any of our PHA's wait lists or list. Next slide. All right, Wayne's turn.
All right. Good afternoon, everyone. My name is Wayne Pollard. I'm the director of Tarrant County Housing. And just to give you some perspective of Tarrant County Housing Assistance Office, we're a Section 8 housing agency only. We don't have any public housing. We don't have any developments. It's just strictly Section 8, and we are a department of the county. We have about 3,400 vouchers. So we're usually dealing with high volume all the time. So I'm part of a lot of national housing organizations. When I heard this was coming down, I was preparing my staff to get ready for this. I didn't want to wait until HUD sent something out. They give us 2 weeks and get it started. So we was preparing before that time. So I was kind of in front of this idea before we got started. I know they mentioned earlier about our relationship with our COC. That is correct. We didn't have a strong relationship, but we knew each other due to some other dealings and received letters of support for some of our other activities. What was most important, though, is that we had a chance to learn about each other. Now, a housing authority thinking is a little bit different than the COC. Okay, maybe our goals, our missions may be a little bit different. But we had a chance after some battles. We had some tough conversations. We got the chance to learn each other, and we did the bigger thing for the county. That was most important. So we came around, agreed on some things, still disagree on some things, but overall, we was able to function. We was able to put an MOU in process to start processing this on day one. We really around June 20th, we was ready to roll. I know you couldn't start until July 1st of 2021. I think one of the things we did, I dedicated an employee for strictly this deal. Okay, if you hear me say the name Kelly, that was the person who was running the lead through all of this. I was the pusher. She was actually one that doing everything. Okay, so Kelly was taking the lead. I'm going to say this up front. The cohort was the best thing ever happened because we didn't have to worry about getting emails going back and forth. We had everything in one database. It was easy to look at. We was able to download documents. And for us, we were used to that because we're a paperless housing authority. So it was usually using that kind of a process. When the referrals came through, Kelly was watching this by the hour. Every hour she was going to it, taking off names, taking off names, taking off names. So we was pushing this from day one. So when she got information, determined family was eligible, we didn't wait. We was doing briefings any way possible. Unlike our normal process, our normal time frames, we were doing oral briefings over the phone, virtually, in person, whatever it take to get these families housed, we were willing to do that. Next slide, please. Kelly's other role was to assist families finding units. Their caseworker was doing it. Kelly was doing it. I was doing it. Everyone was involved. Fortunately, we have a very good relationship with landlords. Okay, a very good relationship with landlords. So a lot of this was sort of easy for us in some ways, but we opened up to some more landlords, especially with some of the incentive money. Again, HUD, great job with the incentive money because that opened doors. Some of these families had some bad backgrounds, criminal, rental histories, and it was challenging. But with that incentive money, it gave us a chance for them to get housed quicker. We got to a point where landlords was calling us, Tarrant County, telling us, hey, we got this opening. How many people do y'all have? They wanted to work with us because we were responding so quickly because they didn't want to wait. we did what's called a promissory note that we provided the landlord and said, we promise to make the application fees, their down security deposit, or whatever case it may be. So that helped out a great deal, and we was going to honor that part of it. Kelly, and the same as the caseworkers on the COC side, we transported families around. We purchased a vehicle just to do that. So we try to do everything in our power to get those families off the street as quickly as possible. I mentioned earlier about the incentive fees. Again, great job, HUD, great job. Leases, we expedite the entire process. We did things outside of the norm. We probably inspected a unit while Kelly was still trying to determine somebody's eligibility. We was matching people as we go. So our normal process is do step 1, 2, 3, and 4. But with EHV, we was all over the place, trying to get everything done as quickly as timely as possible. Another thing, we was buying items for families immediately. Kelly loves shopping. She goes to the store, get the credit card, and she at Walmart. I mean, time my family moved into the unit, within the next 6 hours, Kelly was bringing them a basket of stuff that they need. She go through trying to fit exactly what they want, and she went shopping for them. So again, the bills came through, we was paying them timely. Thanks for all the incentive money was out there to allow these things to happen. Again, thank you, HUD. One thing I can say again, you guys, HUD created an emergency housing voucher dashboard. I love it because it was a competition for us. Okay. Again, I'm an athlete. I love competition. I love to see Tarrant County's name up front. So again, I'll push Kelly, my other staff, to make sure we stay up top. Let's max out our numbers. Let's get all the incentive funds we can so we can provide better service for our families. And we was able to took us about 6 months to get through 85 families. And I'm saying this out loud, we need more vouchers. We need more EHV vouchers. So if anything comes available, we're willing to do that. Next slide, please. So again, the goal of all of us guys was house families. House families, get the families off the street. Reaching out to landlords is the thing that we need just for our regular program, but as well as for EHV. Landlords are a key to this program. And we have a good working relationship with these landlords. The incentive money, again, it helps out a great deal. And also we learned that we can move a lot faster than we normally move. You know, sometimes housing authorities can kind of move a little slow here and there. But with that incentive money was involved, we was able to move a lot faster. So I hope we can learn some lessons throughout this process. The case managers and COC staff, they did a lot of communication back and forth. We basically developed a relationship now. So any other future programs will help us get started much faster because we do have a good working relationship. Next slide. I mentioned earlier about the relationship with the landlords, the incentive money. I have to thank Kelly. Again, anybody knows me, I'm a pusher. I'm a push all the time. And she was able to tolerate me throughout this process. But she did an excellent job, and I'm very thankful she agreed to take this assignment. My overall staff, everybody did an excellent job in that process because it was a team effort among everybody in the county. Again, we're waiting for some future vouchers to come again. Build Back Better Act, if they ever pass, anything like that, we're willing to do what we can to get our families off the street. So I think that's it at this point. Is there another slide?
I just think, well, at the end is what Wayne suggested earlier or asked for or requested earlier is for additional vouchers. That's what we're hoping that we can get. We think that we might get some. We're hoping we get some. It give you some more context of the people that were literally homeless that we house. We ended, because of the EHVs, we essentially ended, 23,000 days of homelessness, or 63 years of homelessness by housing them. That's the accomplishment. I will give Wayne mentioned two really key things. That promissory note, that is essential. That really, we heard so many positive things from that. So much that another PHA requested, was trying to figure out what to do with it, and once they got it, made it their own version of it, they were actually to be more successful. It really helped them, and also to tell you that every one of my providers loves Kelly. They love Kelly. They love working with Tarrant County. They never worked with her before, never worked with Wayne's before, but they love this process. And so it was great to have that, to see that as one of the end results.
So thank you so much. I have many, many questions. Also, I'd be concerned that Kelly has now gotten some job offers for people on the call. But I do have many questions. This is amazing. Let me just start with that. And I just want to applaud you for how well you've jumped into this and gotten people housed. It really is amazing work. But let me just walk through a couple challenges that people often have and tell us about and how you sort of address them. So one of the things you hear often is just it's so hard to find housing, and landlords have so many better options than renting to people who, like you said, have poor credit histories and normally they wouldn't think of as model tenants. So can you talk about, like, you mentioned you already had a good relationship with landlords, but what were like the keys? What are the strategies you think have been most successful to help bring landlords into the fold here?
Now, this is interesting. I did a presentation yesterday strictly on this topic about working with landlords through the Housing First Voucher program. Honestly, the key is communication. Communication with landlords. You hear stories about the Section 8 programs overall, especially families that are not going to take care of the unit, they're going to destroy things. But going out there, that retail politics, actually going out there, meet them, get them opportunity to get to know you, tell them forget about the rumors, let's tell you how this program really works. And it's a one landlord at a time. And that's the approach we took, or we take all the time in working with our landlords. Let us explain the story to you. Let's tell you what we can do to support you. Give us a shot. Just take one family. You don't got to take a bunch of them. Take one at a time. The word of mouth is the biggest thing. Once we start having success over the years, landlords are more and more willing to take the risk if they know that we're behind them and we're supporting the process.
That's great. Thank you. We have a question in the chat about the promissory note idea that you talked about. So is that something that you're able to share somehow with people? I don't know if there are links, you have a standard template that you use or links to that.
Yes, what I would do, I'm going to put my email. I should put Kelly's email in there. I'm putting my email address in there. And if anybody wants a copy of that, we'll send it. It's just a standard promissory note that has been used. And it's basically going to say we're promised to make the payment for security deposit. What else? Security deposit, application fee, hard house fee, and several things, and how much we're going to pay. And it's for what client. And we sign off on it in my office. We give it to the landlord in advance. Once they accept it, they know we pay within 30 to 45 days, and we get that information out to them. And the key thing is we're going to be good with that promissory note.
So rather than having 100 requests for this, we'll coordinate with you and we'll post it when we post the recording of this webinar.
Perfect.
So everyone can sort of benefit from that. Thank you so much. Actually, a follow-up question, and also one I'm interested in, is the landlord incentives. What was that? Like, how much did you give landlords, and what did that look like? Was it just like a signing fee? How was that structured?
We was basically able to pay up to 1 month of rent. The monthly rent was going to be. It was a case-by-case deal. We gave some landlords like $500, $250 just for signing the deal. Some people we have to negotiate a little bit more with. So we was extremely flexible, all depending on the need. The bigger the unit, the more we was willing to give towards that unit type of a deal. If we had a harder house family, somebody with bad credit, poor rental history, we were willing to give money for that as well. So all of that was on the table. So we had some written guidelines that we followed to some degree, but we had some flexibility there as well to get those addressed.
Great. I also have a question about ESGCV funding. And I'm just curious about whether like you sort of used other either continuum of care funds, ESG CV funding, or other funding sources from the homelessness side to sort of help. I mean, you mentioned caseworkers who were involved in this. Did you have other resources like that you used, and how did you use those?
We actually did not do that. And I think it was part of how we moved so quickly, actually, because we weren't trying to figure out how to make the funding align. We just said, this is what our community needs. Part of that was, again, our assumption that we were going to, our assumption based on our geography, that there were more people who needed long-term rental assistance more than they needed case management, which is kind of a local geographic issue. And then also specifically targeting clients that we didn't think would need services. And that 20% overage that we did during referrals was kind of part of that. Like the ones that were going to make it in their own on an EHV were the ones that were going to get to the EHV first. Do you want to add anything to that, Anthony?
No, I would, yeah, that's what I would say. I mean, the only thing I would say that there is a ESG CV component is that there were some people who are going to run their their ESG or CV program is going to run out. And those ones were like made immediately to either Tarrant County or other PHAs. They were put on the list like, hey, there's a deadline right here for this client, and we need, if you can make this happen, please make this happen. You don't have to look for housing; they're already housed for the most part. If they can pass inspection, which was an issue, yeah. So that's the only strategy that we when it comes to the ESG funding.
And thank you so much. And there's so we have a question about the PSH move on strategy. So how did you sort of identify people who were interested in doing a move on from PSH? What did that process look like?
We asked our case managers. That's what they're there for. They should be able to know their clients well enough. And if they don't, then that's an indictment on us and them. It's not, I mean, this is where we get, I think we get to a point where we can get real technical and we see we need to build these all complicated systems and surveys or assessments for clients that a case manager should be able to ask. If they're a true case manager, if they're really working with that client, they know that client. And a lot of times they could have been working with that client for 10, 20 years. They could have moved on a long time ago, probably to a house and choice voucher if there had been one available to them. So that was the logic. It's just the case manager should know their client. And if in the case manager, it's up to their judgment. Do you think your client can live independently without your services and just needs rental subsidy? If they said yes, that's the clients we moved on.
And did you have sort of a transitional support mechanism? Like, did they stick with them for a few months, or was it pretty much they were, you know, once they moved into the housing, maybe a phone call a week later, but that's about it?
I would say it's the latter one, but it might depend on the individual case manager. If they wanted to keep in contact with that client, they might have. But we didn't have a plan or a written policy in place for that.
Okay. So did you find you had a lot of people in permanent supportive housing who sort of fit that profile of like really didn't need the services and probably speaks to like other structural problems, but did you find you had a lot of people in that situation?
I would say we were hoping so our EHVs were a little over 300, so we were hoping we would find 150. It ended up being a little bit less than 100 by all said and done. So it's still not bad. It really made a difference for PSH and opened up a lot of PSH slots essentially because we were able to move on clients.
Great. And do you have any sort of feedback about how well that PSH move on has worked? Are those, I know it hasn't been that long, but have those clients transitioned well, or are things going well, or what have you noticed there?
I think maybe Wayne can answer because Wayne did get a lot of our move on, so he can probably give you more details than I can.
No, initially, overall, I was concerned about this population. Maybe because they're homeless, I thought it would be a lot of turnover. And knock on wood, to date, we have not had anyone have left their unit since July. And trust me, I work with VASH, I work with Mainstream, and those families have tendency to turn over in 3 or 4 months sometimes. So they've been pretty solid. And to our knowledge, we have not got any phone calls from landlords addressing any kind of major behavior problems either. So that just tell you that these selections for the move on folks were great selection, that these folks was able to move, to live independently without case management services.
Got
At least
it.
for this point.
Yep.
Yes, so far.
And one last question I wanted to ask was about coordinated entry. So you mentioned that, I mean, just there's a sudden increase in workload for people who are doing coordinated entry work. How did that work? Did you add staff to coordinated entry? Did you just sort of have a sprint? Did you just make everyone work harder?
Well, in this process, as I said earlier, is that we had a lot of staff assist. So planning came in and helped out with coordinated entry too. That cohort list, they helped with that cohort list. They helped with the document piece. I had HMIS come in and help assist coordinated entry. Currently, we do have 3 people assigned to coordinated entry in the coordinated department. At this time, through the majority of this, we had 2. What had to happen eventually is that once everyone was winding down and going back to their normal jobs, we had one coordinator manager focus on EHVs, and the person that was underneath him focus on doing basic coordinatory stuff and signing matches and stay on top of that. That did get overwhelming, so we did add a 3rd person in December. So they provide relief for that department, so they can be able to manage this going forward, because this is not going away yet. And we know this is still be here. It's going to still be here, so we want to make sure we don't overwhelm the department. If we luck out and get up more EHVs, we're ready to do that too. Planning, Alex already said that she will commit some of her staff to me for a little bit to help speed up that process. So we don't want to have a slowdown. And I don't want to kill my staff to do this either. So
Yeah.
Yeah.
And it's kind of a thank you to HUD again, was that you didn't release the NOFA in the summer like normal when we were doing EHVs, because my department does the NOFA. So I told operations, which is Anthony's department, I said, you have my staff until the NOFA is released. And then when the NOFA is released, we gotta sit back and do the NOFA. So we got kind of lucky in being able to allocate staff because the NOFA was later than normal. So thank you.
I wish we could say we planned that, but
You should just say that. It's
so
good.
the last thing I want to ask about is waivers in the EHV program. Obviously, there were a ton of flexibilities and waivers. Can you talk about did you take advantage of those, and which ones do you think really have done a lot of the heavy lifting for you?
Documents, not
Yep.
having those social security cards, birth certificate, the self-certification part. That again, good job, HUD. Thank you very much. I wish we can do this by other special voucher programs as well, because that helped us get people off the street and we can chase the paperwork later. And that's what we're doing now, chasing birth certificates, social security cards, and those kind of deals. But through EIV, we're able to verify their social security, their date of birth, so we're in good shape anyhow, but we still try to get those documents. I think though that waiver for those documents was crucial, especially with homeless folks. They're not gonna walk around with their birth certificates and their social security cards. It's not gonna happen.
Yeah.
So that was a bright idea. So I again said thank you very much for allowing that opportunity.
And
100%.
have you?
Agree.
Sorry, go ahead, Anthony.
No, it's 100% exactly right. That's probably the most important one.
And have you had trouble getting those documents, subsequent to their moving in? You mentioned it's a lot of chasing, but has it caused problems for you?
Not yet, because we're still looking over these last couple months where, again, all of our EHV families went to one counselor. So she could be one focusing on that, and that's what she's doing now, trying to gather those documents. Luckily, the HUD has a database through the Social Security Administration that can determine people's Social Security. So once that's verified, we're in good shape already with that. But getting the birth certificates, most of them are getting SSI, Social Security, so we're able to get those documents in a little bit later on a lot of those. So again, it's going to be interesting, but I think we'll be able to make everybody whole with all the necessary documents.
Great. Well, I think we'll stop there. I want to thank you all for sharing your experiences with us. Again, want to congratulate you on some great outcomes and just incredible implementation work. Again, I'm amazed. I have heard from many communities about all the challenges, and you've had the same challenges, but have really sort of found ways to tackle them. And just again, congratulations. So I want to sort of draw us to a close here. I want to thank all our presenters today. I want to thank all the SNAP staff and others who helped with the logistics and answering questions and everything today. Want to wish everyone a great rest of the day, great weekend. Thank you so much for joining us for the session today. If you have any recommendations for future office hours, please feel free to send them to us, or any questions you'd like us to prep answers for, please feel free to reach out to us. Otherwise, again, want to wish everyone a great weekend, and that concludes the webinar.